Hi, everyone. I'm Kitty Richards, the Director of the State and Local Fiscal Recovery Fund at the U.S. Treasury Department. Welcome to today's technical assistance session on evidence and evaluation. Today's session is designed to assist all recipients of state and local fiscal recovery funds to make the most effective use of their funds by using evaluation and evidence as key tools. In addition, this technical assistance session is to help states, territories, and localities with more than 250,000 residents comply with the reporting requirements of the Recovery Plan Performance Report, which is discussed on page 26 of the Compliance and Reporting Guidance, which is due for the first time on August 31st. In fact, the reporting portal launched earlier this week. You should have received an email about it containing a link to access the reporting system. And if you have any access questions, you can email us at slfrp@treasury.gov. We are recording today's session and we'll post the recording and the slides on the Treasury website in the coming days. Before I dive in, I want to give a brief overview of our session today and let you know where you can find additional information about the state and local fiscal recovery funds beyond the evaluation topics that we will discuss today. As noted on this slide, the Treasury website is your best source of information. In a moment, I'll provide some context on the American Rescue Plan and the State and Local Fiscal Recovery Fund as background for our conversation. Then I'll hand it over to my colleagues. I'll pass it to the Treasury Department's Evaluation Officer, Lenora Stiles, who will introduce Diana Epstein from the evidence team at the White House Office of Management and Budget to give an overview of the evidence-based policymaking. Following that, my colleague Jed Herman will moderate a panel of evidence and evaluation experts from JPAL North America, the Pew Results First Initiative, the state of Minnesota, and the Louisville Metro government. Finally, we'll have time for a more interactive conversation with questions from you all. I would note that this Q&A session will focus on questions related to evaluation, evidence, and related themes. We will not be answering questions today about specific eligible uses of the state and local fiscal recovery funds. Information on eligible uses can be found in the Interim Final Rule governing the funds and the frequently asked questions on Treasury's website. If you have additional questions, you should also email them to slfrp@treasury.gov. Now, let me give some background on the American Rescue Plan. As you know, the administration took office amid a severe public health and economic crisis, and an immediate top priority has been turning the tide on the pandemic and setting the country on the path to recovery. In crafting a response, we knew that we needed to marshal an effort that was sufficiently robust to the challenge we faced. That meant, first and foremost, providing the resources needed to take on the public health crisis we faced and stop the spread of COVID-19. It also meant providing economic support to the families, businesses, and communities who are facing the pain of the economic disruption caused by the crisis. In taking on these challenges, we understood it would not be possible unless we provided sufficient support to state and local governments. At the core of the administration's efforts for an equitable recovery is the State and Local Fiscal Recovery Funds program. This program, addressing the pressing challenges that, as you all know, are facing state, local, and tribal governments. The State and Local Fiscal Recovery Fund is designed to address these challenges and achieve several goals: to give state, local, and tribal governments the resources needed to fight the pandemic, to replace revenues lost as a result of the economic crisis, and to build the foundation for a stronger, more equitable recovery, both by providing immediate economic stabilization for families and businesses still struggling, and by addressing long-standing disparities that have been exacerbated by the crisis. Treasury launched the program on May 10th when we released the Interim Final Rule and opened up our payment portal so that state, local, and tribal governments can start receiving their funding. Next slide. Beyond the Interim Final Rule, the reporting and compliance guidance includes a number of provisions designed to promote an effective use of these funds. First, this reporting guidance is designed to encourage uses of funds that enhance racial and economic equity in communities across the country. This reporting guidance ensures that recipients will focus on equity in their planning and holds them accountable for tracking what proportion of their funds are going towards projects that will benefit economically distressed communities. Second, the guidance requires the recipients to report on how they are engaging the community to inform how funds are spent. Recipients are also required to describe how funds will build the capacity of community organizations to serve people. Third, the American Rescue Plan and Treasury's Interim Final Rule for the SLFRF support public sector employees, essential personnel, and other workers who will drive America's recovery from the COVID-19 crisis. States are required to track their project outcomes over time, and some recipients are required to provide information about what portion of their funds are spent on evidence-based interventions or are being evaluated. These data and evidence provisions are key, as we'll see today. In an effort to ensure that SLFRF funds are spent as effectively as possible and get the best possible results, the recovery plan includes a section on evidence. This section asks recipients to identify what portion of relevant project funds are allocated to evidence-based interventions, or alternatively, recipients may conduct a rigorous program evaluation to determine if an intervention is effective. This information must be included in the recovery plan performance report that all states and territories, plus localities with more than 250,000 residents, are required to complete. Recipients are required to submit a PDF version of their first recovery plan to Treasury by August 31st, and also post it publicly on their website. Recipients are encouraged to use the suggested template posted on the Treasury website. For this initial year, some data from the recovery plan will be required to be submitted into the Treasury reporting system with the first project and expenditure report by October 31st, 2021. More details about the process for reporting is available in the reporting user's guide that was posted on the Treasury website earlier this week. Further, the reporting guidance encourages recipients to develop a strategic approach to building and using evidence by constructing a learning agenda. The guidance also highlights several key resources for recipients to assess the level of evidence for interventions or services they plan to undertake. Specifically, the guidance highlights evidence clearinghouses from the Departments of Education, Labor, and Health and Human Services. These clearinghouses can also help recipients identify evidence-based programs that could be funded by SLFRF. Evidence is defined in Appendix 2 and includes interventions or programs with strong or moderate levels of evidence determined by a randomized controlled trial or quasi-experimental evaluation. While these specific reporting provisions in the recovery plan only apply to states and territories or local jurisdictions with more than 250,000 residents, Treasury encourages all jurisdictions to consider the important role of evaluation and evidence to ensure that your funds are spent effectively. As explained in the Interim Final Rule, to improve efficacy of their recovery efforts, all recipient jurisdictions may use state and local fiscal recovery funds for data analysis, targeted consumer outreach, improvements to data or technology infrastructure, and evaluations. As such, today's session is part of Treasury's ongoing technical assistance to help all jurisdictions to take advantage of and incorporate evidence and evaluation into their spending and make the best possible use of the state and local fiscal recovery funds to support their communities. With that, we'll kick off our technical assistance section to learn more about evaluation and evidence. I'm going to hand it off to my colleague, Lenora Stiles, the evaluation officer here at the Treasury Department, to introduce our next speaker. Lenora?
Great, thanks, Kitty. Hi, everyone. Thank you all for coming, and I want to congratulate the State and Local Fiscal Recovery Fund team for putting this event together today. So in my role as evaluation officer, I've been tasked with building Treasury's own capacity to build and use evidence in support of implementing the Evidence Act of 2019. So I'm thrilled to support an event focused on helping others to do the same. I'm pleased to introduce our next speaker, Diana Epstein, who's been thinking about these issues much longer and much more deeply than I have, to share her reflections on this important topic. So Diana Epstein is the evidence team lead at the Office of Management and Budget. In that role, she supports federal agencies to set evidence building priorities, select appropriate evaluation methodologies, use findings from evaluations and other studies in program design, and develop agency capacity to build and use evidence. So hopefully you'll gain a lot from her insights, and I'll turn it over to Diana now.
Great, thanks, Lenora. It's a pleasure to be here with you all today. My job is really all things evidence. So I'm particularly excited about the opportunities presented by the state and local fiscal recovery funds. So the emphasis on evidence in this program is grounded in a larger federal focus on building evidence and using it to improve government programs and policies. I don't have time today to go over the whole history of federal evidence building, but I did want to highlight a couple of important recent developments. First, there's the Foundations for Evidence-Based Policymaking Act of 2018, or what we fondly call the Evidence Act, which resulted from a bipartisan commission that examined how the government could improve how it uses data and builds evidence. There's a lot in this law, but broadly, it created a new statutory framework for federal agencies to more thoughtfully and systematically plan and organize their evidence and data activities. I wanted to mention in particular the requirement that agencies create multi-year learning agendas, which are strategic evidence building plans that include priority questions where they need to build evidence in order to solve big problems. Agencies are actually finalizing their first learning agendas right now as part of their new strategic plans. So this has been a big focus for us recently. Learning agendas are a great tool that any organization or government unit can use. And I'll point you to some resources at the end that can help. Second, within the first week of the new administration, there was a presidential memorandum issued on restoring trust in government through scientific integrity and evidence-based policymaking. This makes it very clear that the administration will make evidence-based decisions guided by science and data. It also reiterates the importance of agency learning agendas and annual evaluation plans. The state and local fiscal recovery fund has a very strong emphasis on using funds for evidence-based interventions and conducting new rigorous program evaluations. And in case you weren't aware, it does bear repeating that investing in data capacity and evaluation are allowable uses of these funds. All right, next slide. So what is an evidence-based intervention anyway? This can get pretty technical. So for today, I just want to mention this concept and note that the reporting guidance and other resources do have more details. But essentially, we're looking for interventions with strong or moderate evidence based on prior studies that have been conducted. So a strong evidence base means that other evaluations have demonstrated that the intervention causes a positive change in whatever it is that we're trying to affect. The key here is that the intervention has evidence from an experimental study with a group that experienced the intervention and another group that didn't, for example, so that we can definitively say it was the intervention that caused the change and not something else. Moderate evidence is a little less definitive, but still grounded in prior evaluations. Again, I won't get into the details, but the point here is that we're reasonably confident that the intervention leads to positive outcomes. All right, next slide. I've mentioned evaluation a couple times already, so I wanted to go over what this means. So evaluation is an assessment using systematic data collection and analysis that is used to assess effectiveness or efficiency. Evaluation is a really important tool because it's the only way that we can answer certain questions like what is the impact of a program, or did the intervention cause the change we saw in a community, or was it something else? Evaluation lets us understand if something is working as intended, why, and for whom. If I leave you with one thing today, I would hope it's the idea that evaluation is critical for learning and improvement. We need to test whether something is producing the intended results and then learn from that. Evaluation is not just for accountability, and it's certainly not just a way to assign a value judgment to a program. Actually, I want to leave you with two things. And the second is that you have to plan for evaluation at the beginning when you're designing a program or just starting to implement it. Building evaluation in at the front end ensures that you're collecting all the right data from the start, that you can set up a study to determine causality. Essentially, you're setting yourself up for success. It's so much harder and in some cases impossible to add on an evaluation down the road when you didn't plan for it at the outset. Next slide. As I said at the start, I'm really excited about this focus on evidence, and you should be too. So for one, if you invest your funds in evidence-based policies, you'll have better confidence that your dollars will be used effectively and efficiently. This will let you maximize the value of your investments by putting money towards interventions that have been shown to generate positive outcomes. The focus on evaluation means that this is also an amazing opportunity for you to test new types of strategies or test an existing strategy with a new population or in a new context. By conducting an evaluation, you'll be building evidence about how these strategies work, for whom, and how. And last, but certainly not least, this is a way for you to build or further build a culture of data and evidence-based policymaking in your organization. Ask hard questions, learn from your results, and use those results to improve. Ultimately, this is going to help you serve your community better. Next slide. So to end, I want to make this a little more concrete. So here's a quick example of what this could mean for you. Let's say you want to address educational disparities as a result of the pandemic. You could use your funds to invest in educational services and practices with a strong or moderate evidence base, as I described a minute ago, and please continue to measure your outcomes along the way. Or you could implement an evidence-based education service, but with your particular population, which hasn't been studied before. And you conduct an evaluation to see what the outcomes are with your population. Or you could implement a new innovative education service that you design based on your community's unique needs. And again, conduct an evaluation to see if it produces the intended outcomes. In all cases, you'll be collecting data and analyzing results, which will allow you to understand if, in fact, these educational disparities are being addressed by your program. If so, great. Share those results with others so that they can use similar strategies to serve their students. And if not, use those results to figure out what you can do differently. We all know there's tremendous need in communities across the country, so let's invest our resources wisely so we can best meet those needs. And then at the end, I'll leave you with some resources which will also be posted. So if you have questions, feel free to get in touch. I put my team's email here. I've also included some links to recent OMB guidance documents that have detailed discussions of learning agendas, evaluation standards and practices, and the importance of building a culture of evidence and embedding it in everything that you do. With that, I will pass it to Jed to introduce the panel.
Thank you, Diana. And thank you for your time today and giving us that great overview of the evaluation's basics. That provides a really good grounding for the next part of our session today, where we'll hear from other evaluation experts, as well as state and local leaders who will share examples of how they're using evidence and evaluation in their work. Before I introduce our speakers, I want to emphasize some of the points that Kitty mentioned at the top about the use of evidence in the state and local fiscal recovery funds. The Recovery Plan Performance Report, which is due on August 31st from all states and territories, plus localities with more than 250,000 residents, requires jurisdictions to identify what portion of relevant funds are allocated to evidence-based interventions. Alternatively, recipients may conduct a rigorous evaluation to determine if an intervention is effective. The points that Diana just shared provide a background on what evidence-based means and how to think about this work. As Kitty said, the requirement to report on the use of evidence-based interventions only applies to states, territories, and the largest localities that have to submit the Recovery Plan Performance Report. And the reporting guidance, which is available on the Treasury website, contains information about the specific expenditure categories that require this information to be reported. That said, all state and local fiscal recovery fund recipients of all sizes, including NEUs, can use evidence and evaluation to improve the impact of their funds, and Treasury encourages them to do so, even though they are not required to report this information in the Recovery Plan Performance Report. In a moment, I'll introduce Rohit Nampally from JPAL North America, who will help us understand why evaluation is important for improving the effectiveness of the programs that governments provide, and introduce us to some of the basic concepts on using evaluation in the state and local fiscal recovery context. Then we'll hear from Sarah Dubé, Director of the Pew Results First Initiative, who will share ways that state and local governments can identify and implement evidence-based interventions in their jurisdictions. This is precisely the work that the recovery plan asks jurisdictions to do to identify what portion of their funds are being spent on evidence-based interventions. After that, Pete Bernardi, the Chief Data and Evaluation Officer for the state of Minnesota, will talk about how that state has applied evaluation and evidence to their decision-making, including in the context of the American Rescue Plan funds. The process that Pete will outline is one approach that jurisdictions could take in order to implement and report on how state and local fiscal recovery funds are being used on evidence-based interventions. Finally, we'll get a local perspective from Grace Simmerall from Louisville. We'll talk about both an example of a specific program evaluation that they have done, as well as their larger approach to using evaluation in the city. Louisville's work is an example of how jurisdictions could conduct the evaluations of their state and local fiscal recovery funded projects in line with the recovery plan section on conducting evaluation of projects. And as I said, while states, territories, and large localities are required to report on the use of evidence and evaluation of their recovery plans, these same concepts can also be applied by all recipients of state and local fiscal recovery funds to ensure these funds are getting the best outcomes for their residents. As explained in the interim final rule, to improve the efficacy of their recovery efforts, all recipient jurisdictions may use state and local fiscal recovery funds for data analysis, targeted consumer outreach, improvements to data technology infrastructure, and evaluations. A few last notes before I hand it over to Rohit. We are recording today's session, as we've noted before, and we'll post the slides and the recording on the Treasury website. After we hear from our speakers, we'll have time for a question and answer session. As noted previously, you may submit your questions at any time during today's session using the Q&A feature. We will compile the questions and try to answer as many as possible after our panelists speak. However, I would like to reinforce that during today's Q&A, we will only be answering questions about evaluation topics that are the focus of today's technical assistance session. We will not be answering questions about what kinds of projects are eligible uses of the state and local fiscal recovery funds. Your best source for eligible use information is the interim final rule and the accompanying FAQs, both of which are on the Treasury website. Finally, we're lucky to have such a great group of panelists here with us today, as they're national leaders on the subject of evaluation evidence. I'd like to thank them again for taking the time to join us today, as well as all of you for being with us. And with that, let me introduce Rohit from JPAL North America. Rohit.
Thanks, Jed, and thank you to the team from Treasury for having me on this great panel. So before we begin, I'd like to introduce the Poverty Action Lab. Could we go to the next slide, please? We're a global research center at the Massachusetts Institute of Technology that works to improve the lives of disadvantaged communities by figuring out which social programs and policies work. I sit at the North America office of JPAL, where we focus on partnering with nonprofits and governments in North America to create new evidence on social programs, disseminate evidence on these programs so that we can improve policymaking, and finally working with government leaders on becoming better producers and more effective consumers of evidence. Could we move to the next slide? Great. So I'll start off by motivating why we evaluate. So as Diana and Jed and Katie did a great job motivating it, some of this is a requirement under the new plan, some of it is also a strong encouragement, but I also wanted to give a brief motivating example for why we think it's important to evaluate. Could we go to the next slide, please? So let's start with a problem: high rates of violence in some American cities. Homicide and violent crime rates are far higher for youth being failed by the system, especially young men of color, than their peers. So a few years ago in the city of Chicago, they wanted to see whether a program called Becoming a Man that uses cognitive behavioral therapy could be used to reduce violent crime rates. In order to investigate this question, they ran an evaluation of the Becoming a Man program. Next slide, please. What the evaluation of Becoming a Man showed was this program had a remarkable impact. You saw a 44% reduction in violent crime arrests and a 31% reduction in overall arrests. Subsequent research showed that the program was working because of mechanisms that were part of the intervention around helping students slow down automatic responses. Now, the evaluation results had a huge policy impact. Following the release of the evaluation results, we can go to the next slide, please. Then Chicago Mayor Rahm Emanuel increased funding for Becoming a Man across the city after the first study, and former President Barack Obama made federal funding available to expand Becoming a Man and mentioned Becoming a Man at the launch of his My Brother's Keeper initiative. So this is sort of the long view of what an evaluation can do, starting with a question for how you can tackle an important social program using a given program or policy, all the way up through policy impact. Next slide, please. So with that, let's go a little bit more into what evaluation is, some of which Diana covered as part of her slides. So as part of an evaluation, you're asking a question about a program or a policy. When you do a program evaluation, you might want to see how a process is working or whether the program is working. And an impact evaluation is a specific subset of evaluation where you might want to gauge what the causal effect is of a program on outcomes that you care about. Next slide, please. So when you're looking to do a program evaluation or an impact evaluation to measure impact, what you're looking to do is measure what would have happened in the absence of the program. So you take the program and you want to consider the counterfactual. So what would have happened if the program didn't exist? Next slide, please. So one of the first things you need to tackle when doing an impact evaluation is selecting a comparison group. Ideally, what you want to do is compare the people or the communities receiving a program to comparable or very similar people or communities who aren't receiving the program, so that when you look at the difference in outcomes, you can be pretty certain that any impact that you're seeing is attributable to the program and not to any other factors. Now, of course, that's one of the key challenges with doing an impact evaluation, because once you roll out a program, you don't get to observe the same situation for the people who are receiving the program in the absence of the program. Could we go to the next slide, please? And so when you do an impact evaluation, there are a number of different methods you might use to create this comparison group or consider the counterfactual. You could do what's called a pre-post evaluation, where you compare people before they received the program to the same group of people after they receive the program. Or you might do a simple difference comparison, where you compare some people who receive a program to what you think are similar people who aren't receiving a program. At JPAL, we think randomized evaluations are an especially rigorous way of doing an impact evaluation to get at the causal impact of a program. Could we go to the next slide, please? So what that might look like in the case of a program like the Becoming a Man program is you take your eligible participants, in this case, it was school-going men in Chicago. You run a random lottery where some people are selected to receive the program and some people are randomly selected as a comparison group. Then you run the program, and at the end of it, you measure the outcomes you care about for people who did receive the program to people who didn't. And because the people who received the program were randomly selected, you can be fairly certain that after the program, any impact that you observe or any difference in outcomes is attributable to the program and not to any other factors. Could we go to the next slide, please? So that's a brief overview of what evaluation is and what an especially rigorous randomized evaluation can look like. So now I'll go into some of the resources that are available as you look to either commission an evaluation or look for evidence-backed interventions. So many governments have their own internal evaluation groups. You have groups like Minnesota Management and Budget, which you'll be hearing about a little later, or say the lab at DC. You might also look for your local universities, many of which have in-house evaluation groups or experts at conducting these evaluations. One example of which is the California Policy Lab in the UC Berkeley system. There are also a number of private evaluation firms that do evaluations on a fee-for-service basis. So you could imagine groups like Mathematica Policy Research or MDRC. At the same time, there are a number of free evaluation resources available through groups like JPAL. So we offer trainings and workshops. We also have a number of toolkits and guides available on our website, and we provide technical assistance to government groups that are seeking to do evaluations of their own programs. And I'd encourage you to go to our website or to reach out to me if you're interested in learning more about how JPAL can help with this. Can we go to the next slide, please? And finally, if you're looking for evidence resources separate from evaluation resources, we also have that on our website. I won't go into too much detail here because Sarah is going to be covering that shortly. But we do have a blueprint, a guide for state and local policymakers looking to foster mobility from poverty in their own communities and how they can commission their own learning agendas on our website. And I'll direct you towards that. So with that, I'll hand it back over to Jed and Sarah.
Great. Thanks so much, Rohit. Really appreciate that. That was really good information about how state and local governments can use evaluation to improve their policies, programs, and more effectively spend their funds, including state and local fiscal recovery funds. Now I'd like to introduce Sarah Dubé from Pew Results First. As I mentioned, Sarah will give an overview of some resources the governments can use to determine if their funds are being spent on evidence-based interventions, which can be used and reported in the Recovery Plan Performance Report, as well as otherwise. Sarah?
Great, thanks, Jed. And thanks so much to the Treasury team for inviting me to be here today, and especially to be on this great panel. It's nice to see so many familiar faces and read so many familiar names. You know, Diana and Rohit obviously gave some great overviews here, so I'll try not to repeat much, but we'll just talk a lot about the resources that are available to help you find and implement evidence-based interventions that help you hopefully achieve the outcomes you're looking to achieve. So the good news is that there's a lot out there, a lot of evidence-based interventions that many jurisdictions have identified and implemented. The not so good news is that they're not always easy to find. And even when you do find them, it can be tricky to make sure. Actually, can you not quite go to that slide yet? Could you go back? Thank you. It can be tricky to make sure that those evidence-based interventions that you find are actually the right ones for your jurisdiction. They may not be. But back to the good news, initiatives like JPAL and Pew's Results First initiative have done lots of work to help state and local governments identify and implement evidence-based interventions, and we can all share what we've learned from you. Over the past 11 years, Results First has worked with 27 states, including Minnesota, which is represented here on this panel, hi Pete, and 10 counties to help policymakers prioritize evidence when making funding decisions. And to do that, we've developed a handful of resources to help make the complex world of evidence-based policymaking as user-friendly as possible. Okay, next slide. This has a lot of great information on it, so I just didn't want it to be distracting. So one of the resources that we Results First have developed is this clearinghouse database. It's a publicly available resource that you can access anytime, and I believe the link is in the chat now. As you may have heard, and certainly which has been mentioned already today, national research clearinghouses summarize the evidence of a program's effectiveness, meaning they help answer the question, is this intervention achieving the outcomes that it's intended to achieve? Our clearinghouse database is essentially a clearinghouse of clearinghouses that aggregates information about program effectiveness from 9 national research clearinghouses, making it easy to understand the individual clearinghouses' distinct rating systems because they don't all use the same vocabulary and the same criteria, and compare across them. So you have some programs, for example, in education, that are included in multiple clearinghouses, and they all have slightly different descriptions of the rating. So you're able to use this clearinghouse of clearinghouses to see how a specific program is actually rated by different clearinghouses. So as you can see here on the screenshot, the clearinghouse database allows users to search by program name. So if you know exactly what you're looking for, you know that you already do provide or you want to be providing a specific program and want to know if it's evidence-based, you can just search there in the search bar. Or if you are not quite sure what the program is, but know generally what you want to be looking for, you can filter by categories, settings, rating colors, or by those individual clearinghouses. So following Diana's lead on an example, so say you're interested in identifying and implementing the highest rated evidence-based education programs out there. So first you'd search the clearinghouse database for effective or highest rated education programs, which gives you a lengthy list of options. Unfortunately though, it's not plug and play. You can't just pick one of those interventions from the list and hope for the best. I mean, you could, but you might not get the outcomes that you're looking for. Because how would you know that that program that you select from the list is necessarily going to work in your jurisdiction and meet your specific goals for things like improving high school graduation rates or third grade reading scores? It's different everywhere. So the next step is to dig into each of those effective interventions on the list to understand the populations they serve and the outcomes they're designed to achieve, and then determine which of those are actually the best fit for your jurisdiction. And then after you found the right evidence-based intervention for your jurisdiction's needs, again, for your population and your goals, you're ready to implement it. Now, implementation can get complicated fast, and I won't dig into it because that could take us quite a bit of time, but there are a few basics to keep in mind. First, make sure that the providers responsible for running the program understand how the program is supposed to be operating, and then also have the resources to operate it successfully, which can really be as simple as access to quality training materials. So they have in hand what they need to operate the program successfully. You can also create mechanisms for creating data on how the program is operating, and then use that data to help ensure the program is on track and drive continuous improvement. Again, program implementation is complex. In fact, implementation science is its own field, but there are a lot of resources out there. A great one is the National Implementation Research Network, which has a lot of great reports and tools on their site, and I believe we'll add that to the chat shortly. And next slide, please. Results First has also created something called the Evidence-Based Policymaking Resource Center, which is a collection of research and examples of best practices from states and counties around the country, including many of your own, organized by key components of evidence-based policymaking, which we define as these 5 components: program assessment, budget development, implementation oversight, outcome monitoring, and targeted evaluation. So you can find lots of examples of how other jurisdictions have successfully implemented evidence-based interventions, along with examples of how jurisdictions have used data and evidence more broadly to invest in effective programs. So brief example, take the first component, which is program assessment. This is loaded with research that we at Results First have conducted, and also best practices that we've collected on how jurisdictions have developed a common definition of evidence, so that all stakeholders are singing from the same song sheet. And that's very helpfully defined in the SLFRF reporting guidance. And then also how they've used research on program effectiveness, like from the clearinghouses or the clearinghouse database, to determine if a program is evidence-based. So lots of great information there. I think we're going to add that link to the chat as well. So I'll wrap it up by just reiterating that finding and implementing evidence-based interventions that help improve the outcomes you're hoping to improve is easier said than done, but there's a lot of great resources available to you, including and perhaps most importantly, examples from other state and local governments who have done similar work. And with that, I'll turn it back to Jed.
Great. Thank you so much, Sarah. Really appreciate you sharing the information and all those great resources about ways that state and local governments can assess their spending to determine if it is evidence-based, identify potentially evidence-based programs they can implement in their jurisdiction. Now let me introduce Pete Bernardi from the state of Minnesota, who will give us some real-life examples of the processes that governments are using that will help them report on the use of evidence in their spending for the state and local fiscal recovery funds. Pete?
Thanks, Jed. I'm going to start with a quick example of an evidence-based program here in Minnesota that actually predates recovery funds, but reflects our prioritization of evidence and evaluation. We were looking for ways to prevent substance use among youth in our communities, and we found the Life Skills Training Program, which is a middle school-based program that has been found to be effective at reducing substance use. This program is in the Pew Clearinghouse database that Sarah just shared, and it has one of those green circles, which means it's in the highest rated evidence category. We are now implementing it and doing fidelity monitoring so that we have visibility into whether we're delivering the program as designed. And we're also doing impact evaluation using the randomization approach that Rohit from JPAL explained to learn about the impact here in Minnesota, and then also to contribute to the additional learning of the field, the broader evidence universe. As we look at the next slide, I'll briefly share how we help our decision makers use evidence when they're allocating resources. In short, we work with our partner agencies to identify which of their ideas and proposals have evidence of effectiveness, and we use the clearinghouse database among other clearinghouses to do that. And then we identify those that don't have evidence of effectiveness, but that could be evaluated using an impact evaluation. And JPAL is an excellent partner for doing that. There's plenty of other academic and other partners that you can work with to develop an impact evaluation proposal. And these proposals, whether they have evidence or would have an impact evaluation associated with them, are favorably flagged for policymakers during their decision-making process. We're already using recovery funds to support a few evidence-based investments, specifically academically focused summer learning programs, summer preschool, and expanded access to tutoring. And we're going to be working with agencies and policymakers in the coming months in the way I just described for the resources that we've not yet allocated. On the next slide, we see another process by which we can think about infusing evidence. This shows key milestones in the grant making process. And each of these steps has an opportunity to incorporate evidence and evaluation into it. But today I'm going to highlight the second one, which is the request for proposals creation and publication. And actually, if we go to the next slide, I'm going to go ahead and just show 3 ways that you can incorporate evidence into requests for proposals. The first example uses a light touch and merely highlights evidence-based services that are eligible uses of the grant funds. The second example indicates that applicants proposing specific evidence-based services will be given a preference. It could be a general statement like this, or there could be specific point amounts associated with it. And then the third example specifies that the funds can only be used for specific evidence-based services. And with that, I'm going to turn it back to Jed. Thank you very much.
Great. Thank you, Pete. Appreciate you taking the time to be with us here today and talk about your work in Minnesota and how you are using evidence in your process, both from deciding how to use funds and deciding how to spend those funds and allocate them to specific grantees or contractors. I'm going to hand it over to Grace Simmerall from Louisville in a moment. I want to note that after her, we'll have some time for some Q&A. So feel free to ask the Q&A in the Q&A box. We've gotten lots of questions, so we'll try to cover as many as possible after we get to Grace. So Grace, tell us a little about how you're thinking about evidence and evaluation in Louisville.
Thank you so much, Jed, and thank you to the U.S. Treasury team for having me speak about how we implement evaluations in Louisville, Kentucky. Next slide. The first thing I want to stress is that it's really important, if it's possible at all, to go ahead and establish policy. So indicate from your chief executives that you as a state or local government are very committed to using evaluation as a tool and set standards for how those evaluations should be conducted. In Louisville, Kentucky, our 4 standards include continuous improvement. So taking into account that there are our responsibility to stakeholders, but also stakeholder responsibilities in terms of using the evaluations to determine what changes they need to make to the programs. Accuracy, making sure that we explicitly acknowledge the potential limitations of the evaluation as well as biases that may be present in the data. Equity and ethics, again, making sure that you are taking a culturally responsive and certainly in our case, a racial equity lens towards evaluation. And finally, transparency, making sure that regardless of who conducts the evaluation, whether it's internal or with external partners, that you are committed to sharing that information fully, transparently, internally, and where appropriate, externally. Next slide, please. So for those who might be struggling with how do you actually implement evaluation, in particular with these programs, I wanted to give you a concrete example. This predates the American Rescue Plan funds, but nonetheless serves as I think a really valuable example for how these processes actually come into action. And the particular program in question is our Familiar Faces in Action and Community Treatment Program, otherwise known as F2 ACT, which was a low barrier discharge planning re-entry program for inmates who are leaving corrections. It was identified that we had a lot of return inmates and in particular from those who were experiencing homelessness prior to being incarcerated or were having mental health challenges. And so we established that there was definitely evidence-based interventions around this, making sure that as we did discharge planning, we ensured that inmates who opted in received housing, transportation, medication, assistance with applying for Medicaid, bus tickets if that's what they needed, assistance with identification, and even things like a backpack with clothes and hygiene items. Next slide. And so again, really clearly define the purpose of the evaluation. For us, it was making sure whether it was having the intended impact of reducing recidivism. So we made sure to clearly define what recidivism is, what success looks like, and what complete success looks like. Next slide. So back to what I was saying about continuous improvement. In our stakeholder matrix, you'll see that there are columns that identify the stakeholder, their known questions or interests in seeking this evaluation, how they expected to be involved in the evaluation, set clear deadlines of when things need to be done, and then their commitment on how they would use the results of the evaluation. Next slide. It was also really important for us in our templates to have a logic model that was filled out. So often evaluations stop at just measuring inputs or activities. Maybe they go on to measuring outputs, but really we were very interested in outcomes and impact. And so by clearly identifying this up front prior to the evaluation, we made sure that, in fact, the purpose of the evaluation was aligned with what we were measuring. Next slide. This is a frequent example of what you will encounter, which is that it will probably take more than one data source to be able to complete your evaluation. In our case, we had 2 different sets. There was the F2 Act program participant data, but also the booking records that came out of our jail management system for the participants. Next slide. And so it's going to be really important as part of your evaluation to think through the methodology about identifying these data sources and how you go about creating and doing the engineering work on the data to be able to perform the evaluation. In our case, it was a pre-post, but getting the data built in such a way that you could actually answer the questions at hand is really important. Next slide. So again, a little bit about program demographics. Many evaluations actually end up stopping at this point. We really wanted to press on. It wasn't just about understanding who we were serving. Next slide. Or even the services that they were utilizing. So in this case, we were looking at one-time participants versus repeat participants. We wanted to continue pushing further, so not just on housing. Next slide. Or even the types of other services that they were utilizing, which again, you could see that there's a slight difference between one-time participants really heavily utilizing the backpacks versus the repeat participants, in fact, relying a bit more on the medication side. Next slide. This is really what we're driving at, which is, again, understanding the outcomes of the work, which was how many of these individuals post-intervention, post-participating through the F2 Act program, were falling into our complete success. Our success is defined as fewer number of bookings since release, and our success defined as equal number of bookings since release. What percentage of participants were experiencing that level of success post-intervention? And in our case, cumulatively, we were looking at 78% success. Next slide. And we could even do a calculation in terms of cost savings. So oftentimes your evaluations are going to be looking at there's definitely an expense in terms of running these programs and being able to do the cost benefit analysis, looking at the savings. That, in fact, this was a very conservative calculation of savings in terms of days booked avoided and the cost associated with that. So my recommendation, again, very much in line with what you're hearing from the other panelists, you'll want to define your evaluation prior to the program starting, identifying data sources, making sure that you're pushing through to really measure outcomes and impact rather than just stopping at outputs. And thinking through, again, what you want to truly evaluate with the program, but it could start with a pre-post. We were looking, of course, this particular program, we were looking at doing a random control test, but of course, COVID came upon us and it really was inappropriate for us to do that type of test under those circumstances. But you could always begin with something like a pre-post before you move on to more rigorous evaluation methods. And with that, I'll turn it back to Jed.
Great. Thank you so much, Grace. Really appreciate you taking the time to break it down to brass tacks and show us what an evaluation looks like in a jurisdiction. I think very helpful for the purposes of our time today. So that's the last of our presentations. We'll have some